There is lot of there is lot of there is lot of Assalamu alaikum everyone. Starting with the name of Allah, welcome to today's session of our October monthly webinar by from the Giving Back to Pharmacy in Pakistan platform. Today's webinar topic is effective techniques for building trust with patient. I am your host Amna Noor for today's session. So before starting the session, let me give you a small instruction about today's session. We will be having we have two speakers with us today, and Dr. Alishwa and Dr. Sayyed Jameen with us. After session, we will have a question and answer session where you can post your question and clear your queries. And at the end of the session, feedback link will be shared and you will get the certificate. So starting with let me introduce our first presenter, Dr. Alishba Isman. She has she completed her PharmD from Akhtar Said College of Pharmaceutical Sciences and did MPhil from Rifa University, Lahore. She has 1 year of experience working in Indus Hospital and have 5 years of experience working in Shaukat Khanum Memorial Cancer Hospital as a pharmacist. She is also working as a pharmacist in Shaukat Khanum Memorial Hospital currently. So, Dr. Alishba, welcome on board. Floor is yours. Hello, Dr. Alishba. Are you here with us?
Yes, Assalamu alaikum. Thank you so much for the introduction. So let's start the slides. Yes, so as Ms. Hamna told us, today's topic is effective techniques for building trust with patients. I have no financial relationship to disclose. Inshallah, at the completion of this activity, I hope you all will be able to explain how important effective communication with patients is and identify barriers that you face at your places in effective communication and how you can come up with your solutions. So starting with building rapport with the patient. किसी relationship में at work, family, friends, mutual trust and respect are the aspects that are very important in our daily life. So it is very important with the patient, you have open and honest communication. Be honest with your patients, have open communication. I would like to quote an example here. For example, I specifically remember I started my career. I was a resident at that time. So my पास एक patient आए थे, and he was taking methotrexate for rheumatoid arthritis. So it was my first time dispensing methotrexate other than as a chemo agent for cancer patients. So I asked him, and he told me कि नहीं मैं पहले से भी बेटा लेता आया हूँ. It was available in his medication history as well. But it was my first time doing it. So I told him कि आप मुझे 5 minutes देंगे, sir. So I just want to have it confirmed, the doses, the route of administration from my senior, ताकि आपको जो medicine जाए, it's a high rate medication, तो वो properly dispense, so आपको properly method पता हो. So he was very happy. He was like, yeah, sure, take your time. And because honesty is very important, जैसा कहते हैं ना, honesty is the best policy. So वापसी भी after having his medicine dispensed to him, वो जाते हैं मुझे पेपर के ऊपर लिख के गए थे कि बेटा may you live a very happy life. और मुझे दुआ दे के गए थे. So it's very important in any relationship with your patients as well to be honest, have an open and honest communication with them. It is also very important to have an environment where your information is less likely to be withheld. Proper environment where patient, you can give proper time to the patient. You can properly listen to the patient. You know कि बहुत ज़्यादा शोर हो, patient को आधी बात समझ आए, he or she can only remember half of the information that was given to them. So this is very important. So this is an added tool, इसका tool का नाम added tool, that can be used and that can clear up our points over here. Acknowledge when you go to the patient, like if आप discharge होने जा रहे हैं, या patient comes up to you at your pharmacy. So greet the patient by name. It's very important, like you sir or ma'am, to give respect. Respect should be given to patients as well. Make eye contact. It's very important कि ये ना हो कि आप when the patient you're dispensing medicine or you're dealing with your patient, so your only focus is on your computer or on your HMS. It's very important to have good proper eye contact with the patient. Body language and tone is very important as well. Smile at your patient and acknowledge the family members and friends in the room as well. So we know okay, the family members or the friends that are the caretakers of our patients, they're absolutely very important, crucial part of the therapy of a patient as well. So it's very important that you acknowledge them as well, greet them nicely as well. What this will do is, this will increase the safety from a patient side. Very important to introduce yourself with your name, your profession or experience, whichever is right at the time, because patient ko pata ho कि okay, for example, I'm discharge देनी हूँ patient को, and I went to the patient कि oh, this is the pharmacist. The pharmacist, I'm at the moment मैं pharmacist से बात कर रहा हूँ. So the person जो मेरी medical query solve कर सकता है या मेरी कोई therapy related query solve कर सकता है. So this is very important because this helps build trust from the patient side towards their pharmacist and pharmacy. Duration is also very important. To give an accurate time expectation for a current session to a patient. Obviously, I'm like triage करने से, for example, कुछ patients, very simple medicine may not need much time as compared to if you're dispensing a medicine, for example, an oral chemo to the patient, might need much some time. So this is the skill development कि make sure कि आप उसको draft out कर सकें कि patient हर patient के कितना expected time है, किस तरह वो उनको पता हो कि मैं हाँ जी मेरे पास टाइम है कि वो अच्छे से आपसे अपनी क्यूरी से पूछ सकते हैं. They can prioritize कि हमने पहले क्या बताना है, क्या लेके पूछना है, यानी कि बस जल्दी पेशेंट को आपने बता दिया, पेशेंट को आधी समझ आई आधी नहीं आई. because this decreases anxiety for the patient. Yes, I have time. This is the following question that I need to ask first. These are my queries that I need to have solved in this session. Explanation, explain step by step what to expect next, answer their questions, let the patients know how to contact you. Now, this is very important. Okay, for example, explain the patient, for example, कुछ geriatric patients आते हैं, or the patient has been diagnosed with hypertension, for example. I'm pretty sure कि हम daily life में हम हर कोई इस तरह की queries के साथ गुजरते हैं. So the patient has now knows कि, oh, I have to take antidepressants for the rest of my life or for a very long time. So explain the patient why this is important. There might be some patients that might be very rigid कि नहीं हम रोज एक routine बनेगी, रोज medicine अब मैंने लेनी है. A lot of patients like that. Explain them why their risk versus benefit क्या आपका benefit क्या है to have a good sugar control or to have a good blood pressure control. So it's very important that whatever medicine or whatever therapy you're giving, the patient has a good idea of why is it required, why is it important for me. So equally answer their questions. For example, I've experienced this as well. Okay, patients आते हैं और they know they have to start taking the antihypertensives, or उनके भी कोई उन्होंने सुना था मेरा फ्रेंड भी इस टाइम लेता है तो उसको तो इससे बहुत दर्द होती थी, उनके मसल में दर्द स्टार्ट हुई थी, वो स्टैटिन ले रहा था. So get to know why so it's very important to answer their questions, why it is important for them, how you can decrease the side effects, how the proper use of medication is important for their good therapy. So listen to the patient and make sure the questions are fully answered. ताकि वो जब they go from your pharmacy, they know कि हमने proper treatment कैसे लेनी है, हमने refills कब करने हैं, and then the patient know how to contact you. A lot of times a pharmacist gets this question कि अच्छा डॉक्टर साहब फिर मैं आपको मेरे बारे में कोई सवाल हो तो मैं आपको कैसे contact कर सकता हूँ. So like in my organization, we have pharmacists 24/7, so can give our organization number and then my pharmacy extension number. Let the patient know yes, सिर्फ बस आप अभी की नहीं आप हमसे बात कर सकते हैं. If you have any query, or if you forgot something, or you need to talk to a pharmacist, so we are available. This is very important for the patient to let their patient know when they are leaving. Okay, pharmacy is always available for their help. Yes, your telephone number or email address. Because explaining will increase compliance when the patient knows when their medicine or their therapy has been completely and fully correctly explained. What's the compliance बढ़ाएंगे? They won't go on missing on their doses. They won't go on taking medicine in an incorrect way. Thank you. Then when your session with the patient has been completed, it's very important that you thank the patient and the caregiver as well. Because again, as I said, the caregivers, specifically in the geriatric settings or pediatric settings, it's very important to have them acknowledge as well that they have been doing a very good job of taking care of their patient, to boost up their morale as well. You can express gratitude for communication and cooperation from the patient side and their caregiver as well. Thank the family members for being there to support the patient, because this will increase loyalty from the patient, trust towards the pharmacist and the pharmacy. So body language, again, this is called a non-verbal communication, which is very important to have a good body language and good tone with the patient. Okay, about rigid, your body language is very rigid. Your tone is not nice or empathetic, which is very important. So as I said, greet the patient with smile, greet them nicely with a happy aura, good vibes. So use of physical distance between people is very important. कि ये ना हो कि बहुत ज़्यादा आप दूर हो, बहुत हल्की आवाज़ में हो कि पेशेंट को आवाज़ नहीं आ रही. Specifically इस तरह के geriatric patients होते हैं, patients कहते हैं कि please आप थोड़ा ऊंचा बोल दें, I can't hear you properly. This is very important because it's seen कि 100% अगर आप information देंगे, so the information retained will be 50%, 60%. Every patient with their healthcare literacy differs. Different patients can remember or understand their condition, their medicine, their therapy, their disease-related problems. So obviously, so it is important कि हर patient की उसके हिसाब से उसको सारा कुछ detail समझाई जाए. Make sure कि when they are leaving, and they have good concept और उन्होंने आपकी at least 80%, 90% बात समझी है. So use of physical distance proper physical distance is very important. So now again, coming to the use of time. जैसे हमने बात की कि proper time हो patient को, for example, obviously, अब जैसा कि if I'm dispensing analgesics to the patient as compared to I'm dispensing oral chemo to the patient, different timings होगी, oral chemo में ज़्यादा चीजें समझानी होंगी, critical medicine related ज़्यादा चीजें समझानी होंगी. So proper time, how to deal with patient, specific patient को कितना time है कि उसमें उसकी सारी जो भी उसकी queries हैं, everything, उसकी treatment है, उसे अच्छे से समझ आ गई है, which is very important. This is a skill that you have to make, that you give proper appropriate time to the patient. Use of eye contact is very important. If a patient comes up to you and you are busy looking at your computer, you are busy looking at your HMS and you're not making eye contact with the patient, will give an impression to the patient that they're not being listened, they're not being here, you're not listening to them, you're not paying attention to them. This will give an impression to the patient कि pharmacy या जो भी healthcare giver है वो doesn't care for us. वो बस अपना काम करी जा रहा है, उसने मेरी बात भी नहीं सुनी, मैं तब देखा भी नहीं है. So it's very important. For example, some medicine dispense कर रहे हैं, or you do need to use your computer device. Be honest. Let the patient know कि sir मेरे 5 minutes दीजिएगा, 5 seconds दीजिएगा, मैं आपको notes देख लूँ, मैं आपकी dose confirm कर लूँ, या आपका route confirm कर लूँ from my system. So let the patient know why you're looking at the computer device, ताकि उनको भी पता कि ठीक है ये patient मेरे लिए ही काम हो रहा है या मेरी ही चीज देखी जा रही है. Use of body movements, as we talked, is very important. Don't be rigid, have a good body language, have a smiling face, good and down to earth tone with the patients. Because what patients आते हैं, किसी patient को पता चलता है कि उन्होंने I have diabetics, तो maybe patient आपके पास आए उस वक्त बहुत परेशान हो. So if you are not welcoming towards them, तो उनकी obvious anxiety और increase करेगी. Use of objects. Now, use of objects is very important as well. For example, in my organization, so when we are dispensing oral chemo, so after explaining everything about the oral chemo drug, we have to give patients patient guides. ताकि patient घर जाके भी they can retain the information. Patient को पता हो कुछ medicines था, it's very important कि patient know अगर मुझसे miss हो गई तो फिर मैंने क्या करना है, अगर मुझसे गिर गया तो मैंने क्या करना है, overdose हो गया क्या करना है. जिस तरह के diabetic patients होते हैं उनके साथ pamphlets दिए जाते हैं कि आपने अपनी शुगर इस तरह कंट्रोल रखनी है, these are the food you can eat, these are the food you can't eat, शुगर लो हो जाए तो what to do, blood sugar high हो जाए तो what to do. इस तरह आप इंसुलिन के साथ देखें तो वो एक पूरी उसके अंदर ही पैकेजिंग के अंदर पूरी पिक्चर्स के साथ वो they provide us with a patient guide pamphlet. इसके अंदर होता है कि how to correctly use the insulin subcut. So the use of objects is very important. It should be defined at your place that which medicine, which therapy really needs for the patient, for take-home message for the patient. Again, a use of vocal tone and pitch is equally important. Okay. आपकी for example जैसे मैंने कहा geriatric patients को कुछ patients होते हैं वो उनको ऊंचा सुनाई देता है, they specific against geriatric settings में. So make sure vocal tone is correct, your pitch is correct, the patient can hear you properly. At one time you are dealing just with one patient, ऐसे ना हो कि there are multiple patients at your window and बहुत ज़्यादा वो rush हुआ हुआ है. Give proper time to one patient at a time, listen to them properly. This will increase patient satisfaction as well. So engage in active listening. It is very important to engage in active listening. If a patient comes up to you and the patient says कि ओहो मैं तो ये medicine नहीं खाता रहा, मैं बीच में miss करता रहा हूँ, या मैं ये अपनी antibiotic formula तो दूध के साथ पीती आई हूँ, तो don't react to the idea, don't react to the patient कि नहीं आपने गलत किया, आपने ऐसे नहीं करना था, आपको बताया था, but react to the idea. वो क्यों ऐसे करता था? Or patients tell कि no, I have been taking Ubrol and acetaminophen and paracetamol, or along with just paracetamol, I have been overdosing on some kind of analgesic. Don't react to the patient, react to the idea. Why is it important? क्या वो उस वक्त कोई अपनी class में थे या work पे थे, they needed a quick fix for muscle pain or something like that, or headache or something like that. So react to the ideas. Try to listen why the patient has been doing this. वो इस तरह क्यों करता रहा है, and how I can make sure कि अब patient इस तरह करे या ना करे, उसको मैं किस तरह समझा सकता हूँ, how can I have their query solved, how I can get my message across through the patient. So read the patient's body language. Again, obviously कुछ patients आपके पास होंगे, वो परेशान होंगे, they want to talk to you. So give them confidence that yes, they are being listened, they are being heard. so they can talk to you. क्योंकि वो आपके साथ जब discuss करेंगे, a lot of your own points अपने will be solved. आपको उनकी information पता चलेगी, and you can actually guide the patient properly when you know where the patient is coming from. Listen to the patient's tone and voice as well, and the patient's words as well. Okay, patient की कैसे मैंने बात की, for example, कोई patient has been taking some statin and tells me मैं तो सुना इससे liver खराब होता है, मैं तो सुना इससे kidney खराब होती है, मेरी इस दवाई से तो मेरा friend लेते थे या उनको तो बहुत ज़्यादा दर्द होना शुरू हो गई थी. So listen to the patient's words as well, कि उनकी जो worry है वो किस side से आ रही है, और मैं किस तरह पे patient को convince कर सकता हूँ कि why the benefit versus risk, कि आपके लिए ये beneficial है, ये होगा तो आपने अगर you feel some kind of side effects, so when to call to the doctor, when to call to the emergency department. So listen to the patient and their words as well. वो किस पे emphasize कर रहे हैं, उनका background क्या है for the QE. Permit silence in the interaction by allowing the patient to pause and think between the questions. Don't rush the patient. Let them think. जैसे मैंने कहा कि healthcare literacy होती है, every patient has it differently. So don't rush the patient. Let the patient think. Let the patient prioritize. तो क्या पूछना चाहते हैं, क्या अपना वो clear करना चाहते हैं. So give them time, give them confidence that they are being heard. So and avoid judgment while listening to the patient. So moving on to empathy. So why is empathy is important? That can really improve the creativity, make the patient feel very safe, emotionally connected, and you can negotiate and collaborate with the patient like with this. So what is empathy? It is to understand the feelings of the other patient or the person and be able to work out to help them out in it. So it's important that we develop this in our regular life, be empathetic, understand the person's feelings, convey interest, that we are interested in hearing what you're saying. We are interested to know your concerns about the therapy or medication. Encourage the patient कि जी आप share करें, talk to us, share with your pharmacist. For example, you can use terms like, please tell me more about that. Or please tell me when did you start feeling pain in your arm? At what time does it aggravate? To review the progress and pull together important ideas and facts. जब आप patient को confidence देंगे कि वो आपसे बात कर सकता है pharmacist से, वो खुल के अपनी medication के बारे में पूछ सकता है, और their QAs will be solved, they'll be helped out. So that will really improve to keep progress or keep notes on the patient and get information, very important ideas and facts. So like for example, with chronically using patients and they're using some inhalers or insulin, so the patient comes up for a refill at your pharmacy. So it's important कि आप उनसे ये नहीं assume करें कि जो शुरू से use कर रहे हैं उनको पता ही होगा. Ask them how have you been using it, आप किस तरह use करते रहे हैं, to make sure कि patient जो अपनी chronic medicines भी हैं वो correctly ले रहे हैं घर जाके भी कि नहीं. Clarify what is said to get more information. जिस तरह के where did you experience those muscle pains? At what time do you think you experienced such headaches? Something like that. Restating is very important. जिस तरह के अब आपने patient की बात सुनी, so restate, confirm कि it sounds like I've given an example over here. Okay, it sounds like you would like to try all your oral medication options before switching to insulin. Am I right? Because this will give an impression to the patient कि उनकी बात सुनी गई है. They have been heard. This will increase their confidence. This will increase their morale and trust towards the pharmacy and pharmacist. Acknowledge the worthiness of the other person as well, the caretaker, and the patient as well. For example, if a patient has been keeping good track of their blood pressure, a good track of their blood glucose, so praise them, acknowledge them on that. Praise the caretaker who has been taking really good care of the patient as well. Because ये सब कुछ उनका morale boost करेगा, उनका confidence boost करेगा, and this will help patient to continue correctly with their therapy. So what could be avoided? So avoid closed-ended questions. For example, yes or no questions, like how many tablets do you take? 1 or 2? Are you still taking this medicine? Yes or no? Are you taking this with water or milk? Yes or no? So don't ask just closed-ended questions or yes or no questions. And for example, like leading questions, have you been missing this medicine? Have you been taking these doses properly? Instead, you can rephrase the questions. It's like जैसे कि you have to take your medicines, या कोई patient है वो diet पे है, is on a sodium restricted diet. So you ask patient, instead of taking, have you been restricting your sodium? Yes or no in the diet? Instead, you can rephrase it or ask them in a way, okay, how have you been managing your excuse me, sodium restriction? Through which foods have you managing your sodium restriction? तो उससे वो आपको details बताएंगे, दो तीन चार details बताएंगे. You'll be able to extract ideas. You'll be able to extract what the patient has been doing. Instead of yes or no में answer question बंद हो जाता है. लेकिन आप इस तरह question करेंगे कि that they can take out details from the patient. This will really help you to give an idea of how patient has been doing with their medications. Avoid circling or duplicate questions over and over again, because that can lead to increased anxiety from the patient side. So this is the summary of what I have just talked about. Thank you so much. I would like to welcome Dr. Yamin. The floor is yours. Thank you so much, everyone.
Hello, it was very informative session by Dr. Alishba. He has explained everything very well. So now moving toward our second speaker, Dr. Syed Yamin Hassan. He has been working as hospital pharmacist since 15 years in GCIA accredited hospital. She have done Bachelor of Pharmacy from Hamdard University and PharmD from Federal Urdu University of Arts, Science and Technology. He started his career with Ziauddin Hospital and worked more than 3 years at Aga Khan Hospital, University Hospital as specialized pharmacist for oncology and IV admixture. He joined HMC as a pharmacist in Al Bakra Hospital. Currently, he is working as senior pharmacist at Al Bakra Hospital as well as a pharmacy teaching as well as a preceptor of HMC for pharmacy student. He is also IPTech certified. So welcome on board Dr. Syed Yamin Hassan. Floor is yours.
Assalamu alaikum. Thank you, Ms. Amna. Yeah, first of all, I would like to thank the organizers of Give Back to Pakistan Pharmacy. And It's really a good opportunity for all the students and new practicing pharmacists, especially in Pakistan, to have to get the benefits from the experiences of means how to practice the pharmacy in an ideal way. Okay, so Miss Alishba, yani Dr. Alishba already discussed about the trust, and I would like to just enforce some more points in it. The trust is really it's very important issue between the communication of pharmacist and the patient, and you can say between the healthcare and the patients as well, and it will lead to the acceptance and adherence to the recommended treatment. So if you see the practical examples, it has been observed that if the patient really start trusting on you, it will make the things more easy, convenient, and patient will go from the hospital with happy and यानी satisfying. अच्छा, इसमें ये इसके कुछ there are some essential elements like competence in knowledge. Patient should get the feeling that the pharmacist to whom I'm talking and I'm conversating, he is good in the knowledge. Means because mostly what is observing the patient is mostly trusting on the doctors, on the physicians rather than the pharmacist. But it doesn't mean that you cannot get the trust. Definitely you can get the trust, but there are the way outs. That what Alishba said, different techniques and different tools you will use. So in that case, you need to welcome the patients with smiley face and with confidence that the purpose for what he is sitting in front of you, he will get the full. Like for example, I would like to share that when I came here in Qatar, we had one of the observation from JCIA that there should be no barrier between the patient and the pharmacist. What kind of barrier it is? Which is transparent mirrors, transparent glasses on the counters. So I really surprised that why they are focusing on it. Then when I got to know the details of it, I found that they are saying that if there is a barrier, patient will not be comfortable to talk with the pharmacist. So imagine even they are focusing on it purposely. So this means many things. But now, right now, because of the COVID issues, they implemented it again. But still, the concept is focusing between the communication of patients and the pharmacist. Second thing, even if you don't know something and patient is asking you all of a sudden, it's not. This is not the problem that you don't know about something which is patient is keen to ask. At least you should know the source of info, that from where I can get the information, and I will tell the patient, and just let the patient, okay, just wait a while, I will tell you, and you can just access the source in front of the patient on your system, and you can give the knowledge. This will make him or her also comfortable. It doesn't matter. And it's all depends upon your competency in the communication. That even sometimes patients are aged, patients is frustrated, maybe from the waiting time in the OPD areas with the doctors, with the nurses. But unfortunately, patients are thinking or they are not able to through their aggression and the frustration on the doctors and the nurses, rather than when they come to the pharmacy and they waited even more than 5 minutes, they thought that it is easy to through their aggression and frustration on the pharmacist. So here, this is our role to how to control and how to control our aggression or means our reactions, and how to let the patient calm down. There are the many patients, they are just saying, please give me even 2 minutes, 3 minutes. They don't like to wait. So just let them, please have a seat. I'm here for you only. Just give me a minute. I will check it. And I'm processing only your issues. So you know how to means if you really wants to make the patient happy, if you really wants to give the quality services to the patient, you will definitely able to control it. And it is happening that the patients are thinking that this pharmacist is really supporting me, or he is really supporting my feelings or not. So what the Aliba said, empathy is the important tool here. You should know that really, if I'm in at her or his position, what I will think and what I will do and what I will reply. So when you will use all of these things, you will definitely able to manage it. The most important thing is the time constraints, because I can understand that because this is the practical thing. We cannot make it aside that you have to finish maximum patients in a minimum times. And your workflow is totally depending upon that, because you cannot give half an hour to one patient in the OPDs or in the emergency, because there are many patients in the queue. And this is I am experiencing here, because this is my first time. Since 10 years, I'm experiencing the OPD, but while I was there in Pakistan, I worked only in the inpatient settings and sterile setting. So what I realize also that, yes, for the pharmacist, it's also tough. But with that, you need to make it balance. That not make a counter of the pharmacist like there are no other patients at all and only this patient and I will just make him happy. No, it's not like that. You have to make a balance. You have to focus on his need only. Whatever he is asking, just focus on that and just play in that boundaries. Don't go out and don't give less. It's like that. Second thing is the honesty. Honesty is mostly in the community pharmacies. What I would like to say that in the community pharmacy, yes, you are having a different brands, different things, and you know that if I will sell this brand, there will be a good commission in it, or there will be a less commission in it. You can also make a balance. I don't want to say that you will just escape all the things of the commission and the profit and just go for the other. No, it's fine. It's a right of you, because you are definitely in the community pharmacy. You have also the concerns. At least you should know that if I will be at his position, I can, what should I need? So you can give the patient not high priced or not less quality medicine, at least. So this honesty should be required, especially in the community pharmacy. And you should know, and that what is the best for this patient and what should be the best for this patient, although if it is mentioned in the prescription. Like the most important thing is the confidentiality. Yes, This is a very sensitive issue, specifically in the foreign countries, either Gulf or the West. And this is a legal issues. The confidentiality is highly needed to maintain, especially for the patient in all over the hospital, with the nurses, with the physician, with the pharmacists, because we are the also one of the specialty who have the access to all the patient history and his profile or her profile. So maintain the confidentiality, and it will make at least the patient can when you maintain the confidentiality and you give the feeling to the patient that yes, he will not leak out my issues, or and also you will not discuss with him. You can judge it easily, and you can make an analysis. So patient can ask your advice, and he can open by himself that actually that I have this issue. What would be the better for me in this case? Blah blah. Okay. And really, maintaining the confidentiality is utmost important for all the healthcare staff. The last thing of this trust element is showing respect. Yes, you should respect with the age, with the gender, and whatever the kind of the patient you have to respect them with sir, ma'am, baba, uncle, like this. This is what we are practicing here. And according to the nationalities, we have different kind of nationalities here, and there are many issues. Like recently we faced upon the counter, we faced one complaint logged in our hospital, that one lady, she accused one pharmacist that why she called me mama. So then the manager told us, don't call mama, at least to the females, just ma'am, and like this. So there are these things also. This is just I'm giving as a sort of example. I would like to share with you some practical examples, like what we are facing on the regular basis. First, I would go with the outpatient settings, and then we'll discuss with the inpatient, because right now we are focusing with the communication with the patients, and also there is a communication with the physicians, which is really very important, especially in the healthcare setting. Okay, first, there was a case. I was just verifying the order, and I found the prescription prednisolone 20 milligram daily for 4 days. And then in the comments, we have on the screen, there are the sick comment area where the doctor can write the specialized comments. And the doctor mentioned day 6, 20 milligram, and day 7, 10 milligram only. It's really kind of confused prescription. So what should be the required action by the pharmacist? So what I done, what we should done, that the communication with the physician is utmost important. Don't be hesitate, and don't be overconfident. These both things are very needed. That don't be hesitate to call the doctor, that oh my god, what he will say, he's a senior consultant. No, nothing. You should be confident on your knowledge. If you don't know, just open your references, read it well, and then call the physician, because you are calling the physician who is more near to the patients than you. What I did, I just tried to call the doctor, but unfortunately he was not answering my call on his cell phone. Might be he's busy in the clinic. So then I tried to find who is the clinical pharmacist, because this was the discharge patient. Then first, once I investigated, I found the patient has been discharged today with this instruction. So I called the clinical pharmacist, and what I realized really, that she said patient already took 20 milligram daily tablet 3 days in the hospital, and we need to give him 3 more days 20 milligram. So in that case, this prescription, actually, not instruction, the prescription, which is 20 milligram daily for 4 days, this was wrong. So anyway, I told her that you mean that 20 milligram more for 3 days I will give, and day 6th will be the last day. Means today was the 3rd day. From tomorrow it will 4th day will be start. So 4, 5, and day 6 will be the last day of 20 milligram, and day 7, 10 milligram only, and then stop. She said yes. Then I said okay. So that has happened. But in that case, I didn't criticize on the doctor, and we should not, that why he write like this, and just focus on your things and move on. Don't think that the doctor did the mistake. Okay, mistakes happen with everyone, but the thing is that how you will execute it and how you will rectify it. Okay, second case, it is tolterodine 2 milligram BID. This is what happened, that we have also, if we are working in a hospital setting, we should know that whatever formulary we have, and like we have tolterodine 1 milligram immediate release and 4 milligram extended release available. So the doctor means that 2 milligram BID means 2 tablets from 1 milligram in the morning and 2 tablets from 1 milligram in the evening. Means patient will take 4 tablets per day. So I called the doctor and I asked him that, doctor, if you would like to give 4 milligram extended release once daily, then it would be better. He refused. He said, no, I want to give 2 milligram BID. Then I said, doctor, actually, we have 1 milligram tablet, and patient has to take 2 tablets in the morning and 2 in the night, and maybe patient will not be compliance with that. Then he convinced. He said, okay, give him 4 milligram once daily, this extended release formulation. That's it. So the thing is that if you keep communicating with the physicians with the knowledge and with the confidence and with the respect and with the thinking of the teamwork, definitely he or she will accept your advice, your recommendation. And already in your hospital, if you are communicating with the doctor and working in this environment, definitely this environment is already exist over there, that the physicians have an idea. Yes, pharmacy are also the stakeholders, and they are a final check upon our prescription, and they are saving us. They are saving our errors. So this will definitely happen, that doctor will get convinced, and we succeeded to dispense this 4 milligram daily, once daily to this patient. Another example, that there was a senior consultant of gynecology. He prescribed this 0.4 milligram once daily here, and then first I surprised that doctors, they knows that we have only 1 milligram and 5 milligram from folic acid in our formulary. Why is writing? But anyway, I thought that might be he is mistaken, might be he because this doctor might be he practiced somewhere in the UK or somewhere else, because by the name actually I got it that he is a British one. So then I called him and I just asked him, doctor, you prescribe this much? He said yes. I said, but actually we have 1 milligram or 5 milligram. So would you like to give 1 milligram? Is it possible? He said yes, this is fine. So anyway, so I mean to say, by explaining these example, that communication between the physician and patient, patient and the pharmacist, and patient and physician and the pharmacist is very important. Okay, now we will go through with the physician. This is in the inpatient setting. We have this one. This has happened. Actually, many issues happen in the inpatient setting. But first of all, before explaining this case, I want to say that In my 15 years career, what I realized that especially the new pharmacists who are graduated and came to the hospitals, they are having this thinking that we studied pharmacology more than the physician, so we are more expert than them, so they have to listen us. I'm sorry to say, no, it should be not like that. Yes, we are the pharmacists. We studied pharmacology more than that. We have more good idea than them, but still, they have the patients. They are the one who are seeing the patients. They are the one who are facing different cases of the patients. They are the one who are facing a maximum number of patients daily, and they are facing many issues. They are facing many patients problem on daily basis. Please don't think that I am advocating the physicians here, but just my only criteria of explaining these things is to make a teamwork between the physician and the pharmacist, especially in the hospital setting. So by this way, what will happen, like which has happened while I was working, I was doing the duty on one day in the IV room, and I found the order that ampicillin sulbactam 1.5 every 8 hours. It has been rejected actually, and I found that who rejected this one. Then my colleague told me, no, actually the one pharmacist who is there, she rejected. I said, well, what is the reason? He said that the reason is that she said it should be six hourly, and she called the doctor. When I see the doctor, I know the doctor. I know the surgeon. He was consultant the surgeon, and I called him. Once he took my call, he was very rude actually, although he was my friend. And then I said, doctor, I'm this is Yamin here. He said, oh, I'm sorry, Yamin, actually your name came with the pharmacy and I'm really very young. I said, what happened? He said, your pharmacist called me and she is saying that 1.5 gram every 8 hours I prescribe, and I should make it every 6 hours. Otherwise she will not verify. I said, why? She said that, what is the reason she gave to you? He said, I don't know, but I will not change it, because I am the one who knows the severity of the disease, and I wanted to give this dose right now, and tomorrow after seeing the response I will decide, but right now I will not change. Then I said, no worries, doctor, I will verify it, and with the reason, and don't be worried. I verified the order and I write in the comments, confirmed by the physician. That's it. First of all, this dose, if the frequency from every 6 hours to every 8 hours, it will not make any big difference until and unless we should confirm with the doctor, because we are not the one who are seeing the patient. We are not the one who are looking on the labs of the patient. We are not the one who are making a rounds every day, until unless we are the clinical pharmacist. And if there is a clinical pharmacist, he or she will not do this, what this has happened on that day. So I mean to say, we cannot stop dispensing of the medication if there is something like this, until and unless there is a justified reference that this is wrong. And any consultant, any senior consultant, whoever the physician, they cannot reject your advice if it's justified by the references, and you will definitely able to convince them. But there is a way, how to communicate with them. Don't communicate with the physician by the way that you did some mistake and I'm the winner one who rectified your mistake. Please just let them know, doctor, actually you prescribed this medicines for this patient, and this is the prescription, I'm going through it. Actually, doctor, once I checked the reference from Lexicom or up to date, I just realized that the dose should be like this and with the frequency. So doctor, could you please change it to that one? In my 15 years career, I never experienced any of the doctor who said no. Although I communicated with very tough consultants, but and really the first time I was very hesitating, and I was really fearing that this doctor, because here definitely I'm not in my country. I was going to communicate with totally other nationality, other language, and other things. So definitely I got a fear. But what thing made me confident that first I did my homework and I checked well the doses of that medication. Actually, it was I would say it was clotrimazole vaginal suppository, and we had this 500 milligram available. So what the doctor prescribed, clotrimazole per vaginal 500 milligram daily for 5 days. And that should not be. It should be at least because outside it is available 100 milligram. So I called the doctor, and he said he got stubborn and he said, no, I want to give this. I said, doctor, I'm sorry, I will not able to verify this order. And if you have any reference, doctor, please send it to me, and then I really verify it and dispense the patient. Finally, he said, it's okay, give the patient 500 milligram once weekly. So that is the way we need to communicate with the physicians, especially in the hospitals. And that's it. This is the thing what I want to just communicate. This is some assessment questions. Okay. Any question you guys would like to ask or anything, please, most welcome. Thank you so much, Miss Amna. I'm now ending my my turn. Thank you.
Thank you so much, Dr. Sayyed Jami. It was very informative session. And thank you so much. We have one question. We have two more questions from audience. And it is, how can we remove the language barrier?
Language barrier means you mean in the foreign?
Yes, I think so, in foreign as well as in Pakistan
Definitely.
too, because many
See,
people does not know Urdu. Even interiors in people are urban.
see,
Rural.
see, language barrier. We have an option. Like here, if I want to say, like when we are coming here, we need to, like for Qatar, it's not like Dubai that you must pass the Arabic exam, but at least you must know the basic Arabics about the countings and the basics of the dispensing. But although what I realized, and I saw many pharmacists here who are Pakistanis and Indians, if they are not able to communicate, at least by the actions, by giving 2-3 like this way, they could able to communicate. But it's difficult. So definitely then they started to learn the Arabic language, because they got know the need of that language, which is highly important if they are really dispensing in the OPD setting. And this is the basic requirement of the job. This is the blessing that this is a blessing in Qatar, that we don't need to pass some language exam of Arabic like Dubai. What until now I know. If there is any update over there, I don't know, but here it's like that. So at least, because if there will be complaint regarding the language issues, so it's difficult to carry on that job. And in Pakistan, I don't think so that the people's there will be very few, and in that case, in the hospital there is a system of the language barrier. We have also all the JCI accredited hospital, they have the system of the language issues. Like we have the directory of the peoples on our emails, that if we found any, like I would like to say the example exactly, it's very nice example. uh, After the fall of Afghanistan, here many refugees from Afghanistan came, and we were we were instructed that we have to give them the priority, and if they came, but the issue was the language. Then they started to find the Pathans of our from our Pakistan, and they updated that the language directory, that Afghani language this person knows, and please, if you don't know, please call these guys, and they will come and rescue you in the language and the communication issues. And what we found, it's solved, and it is happened when they were coming in our emergencies. And straight away they were calling any Pakistani Pathan or any Afghani, any educated Afghani who knows the Afghanis and who knows the English, and also the most of the Pathans, they knows the Arabic as well. So there is a system of the language barrier in all the international accredited hospitals. But as well as, because in Pakistan, if I would say, in the light of the Pakistan hospital, in Pakistan there are many hospitals not international accredited, but it doesn't mean that this is a problem. You can find someone who can communicate with them. Even me, until now, if some Arabic patient came and if I couldn't able to understand his or her accent, I'm just asking my colleagues who are Arabs. I said, could you please come, and I'm just telling the patient in the Arabic, at least the little Arabic I know, that please have a patience, some Arabic is coming and he will communicate with you. And they are communicating in front of me with them, and Alhamdulillah, I never faced any critic comments from the patient that why you are not learning Arabic or something like this. So definitely in Pakistan, it's also not the big deal, because if in Gulf, if we can control these things in this way, so why not in our own country? It's definitely easy over there.
Assalamualaikum. I totally agree with Sir. Sir ne bahut has explained in detail. एक छोटी सी होती है, what we practice in our organization as well is we have a list of all our employees, even all the pharmacists. उनको form fill किया जाता है जिसमें they know which language they can read or communicate in, and that is available in our HMS system. And if a patient comes up, okay, doesn't know English or Urdu over here in Pakistan, so that is very easily retractable, and we can have that pharmacist come up and help us out with this. So this is an about detail. These are all JCI guidelines. They have come up with the solutions. Okay, starting with the full list with their contact numbers is available on the employees as well. And sometimes it does happen. I once experienced it that a patient could not speak in or understand Urdu or English, but he was an old patient. So if I couldn't, he was like, okay, if you just dispense me the medicine, I'll go home, but my kids can understand. You just write it down. So I asked the patient, what he was worried about is that there's a lot of the time would be taken. Maybe I wouldn't be dispensed more medicine. I have to wait in a long queue as well. So I asked the patient if there's an attendant with you as well. Usually it happens that the patient couldn't understand the language, but their attendants or their kids can. So this is how you can tackle. You can ask the patient if they have someone with them who can understand that. There are proper translators available in big hospitals as well. And then there are employees translators as well. We fill up the form, which languages we can read and write, and that information is available readily. So these are a few things that we can introduce in our other organizations as well that can ease this problem. So that's a certain about to explain. So thank you so much.
अच्छा, यहाँ पर एक एग्जाम्पल मैं और देना चाहूँगा इस हवाले से. There was a time it was a night shift, and I was in the emergency satellite, and there was a patient came, and he totally know the Arabic. He doesn't know any English. So, and I didn't have in my mind that I have this I should access this translator guide or something, because the problem is that I have to finish the patients as quick as I can, because there is a queue of the patient in the emergency, and this is a night shift. So but what I done, I just tried to look at my arounds, and I found there is a cashier. There is an Arabic cashier who used to be with us on the floor. Then I just told the patient by the actions, just wait. And I went to him and I just told him, please, can you come? I need your help. And he came, and I told him, please, can you communicate with the patient, whatever I'm saying? He said, it's okay, I'm here. And I went back inside the pharmacy at the window, and that cashier came beside the patient, and we communicated with this way. So that's my point, that it's not possible that you will not find any way out, especially in our country, Pakistan, as Alishba already justified it. Thank you.
There a point where I would like to emphasize that when this happens, when you're talking to a translator, you're actually explaining the medication to the translator, and the translator is then explaining in their language to the patient. So it's really important to have that listen back or read back method. You have described everything, ask the patient to repeat everything to the translator, and then ask the translator to translate it to you, that what the patient is saying, so that you can make sure as well that your point has gotten to the patient correctly. So this is very important. You practice this to make sure the patient understood what you have been trying to say through the translator as well. The translator in the middle is a second person. So this is very important to read back or listen back in the opposite, anti-clockwise, perhaps. So this is good.
Yes, very good. Very well answered question by Dr. Alishba and Dr. Syed Jameen. And I would like also to emphasize here, listening is the most important to communicate well with patient. So we have one more question. What should we use as a reference while answering question of the patient if we don't know the answer clearly? Like, अगर हमसे कोई पेशेंट क्वेश्चन पूछता है तो हमें किस रेफरेंस से उन्हें आंसर देना चाहिए? Reference books or apps, anything. So what will you refer, Dr. Lishba?
Yes, this depends on what the question is. There are very good internationally approved references, for example, like Lexicon for doses and side effects, and a lot of questions that patient asks is, oh, but if I missed the dose, oh, I missed the dose. So these all things are given in Lexicon, Micromedics, or if you need to go for the clinical guidelines, then there are different associations available. For example, American Heart Association for the cardiology-related queries. But for drug query, I think Lexicon and Micromedics are one of the really good examples, and they're accurate as well.
Okay. Thank you so much, Dr. Lishba and Dr. Syed Jameen, for joining us today from your busy schedule. And thank you so much, all the participants, for joining us today and learning this. I hope you all have a good learning experience with us. We will be having our next session in the next month at the end of November, inshallah. Don't forget to join us.
Thank you so much. Thank you for the opportunity for having me. Thank you.
Thank you so much. Thank you,
Thank
Amna.
you so much. Thank you so much, Alvira.
Thank you so much.
अस्सलाम वालेकुम रहमतुल्लाह।
वालेकुम सलाम सर।
बहुत बहुत शुक्रिया आप लोगों का। इंशाल्लाह ताला फिर बातचीत रहती है। आई थिंक आप लोगों के जहन में कुछ सवाल हो तो जरूर बताइएगा। मैं अपना फीडबैक आपको इंडिविजुअली दूंगा इंशाल्लाह। आई थिंक ओवरऑल इट वेंट वेरी वेल। मेरा ये ख्याल है कि हमें जो है वो जस्ट नीड टू ब्रिंग ऑडियंस जो है ना बैक टू Zoom वो सब्सक्रिप्शन की लिमिट थी, इस वजह से हमने इसको सोचा था कि यूट्यूब पे स्ट्रीम कर दिया करेंगे। आपका
ठीक,
क्या
ठीक।
ख्याल है इस बारे में कि हम जूम में लाएं तो वो ज्यादा बेहतर होगा या दिस वाज बेटर? या
तो
मीन
इस पे YouTube पे क्या इशू हो रहा है ये सिद्दीकी भाई?
कोई इशू नहीं था, कोई इशू नहीं था। हमारा मकसद था कि यूट्यूब लोग आसानी से एक्सेस करते हैं, कोई डाउनलोड करने की जरूरत
Yes.
नहीं होती, तो इसलिए हमने उसको रखा हुआ है अभी तक।
I agree as well. सर मैं पूछ सकती हूँ
Okay.
सर्टिफिकेट्स हमें भी मिलेंगे?
हाँ बिल्कुल, इंशाल्लाह ताला आप लोगों के
Okay.
वो send it out within this week इंशाल्लाह।
हाँ, okay.
ठीक है,
Thank you so much.
तो
Thank you.
चलो इंशाल्लाह, बहुत बहुत शुक्रिया,
And
अपना
thank
ख्याल
you so
रखें।
much, sir, for the
Thank
great opportunities. We look forward to working on this platform. Thank you so much. Jazakallah.
थैंक यू, आमना।